Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about amniocentesis during pregnancy. Amniocentesis is a test in which fluid is removed from the amniotic sac to test for problems. This fluid surrounds the fetus in the uterus and protects it from injury and against infection. It also allows the baby to move more freely and to develop. Fetal cells that float in amniotic fluid can be grown in cultures and are used to identify some birth defects. We know of more than 400 abnormalities a child can be born with. Amniocentesis identifies about 40 of them. Amniocentesis is often offered to women at higher risk for birth defects. It may also be used as a follow-up test when an earlier test suggests a problem. There are various conditions in which amniocentesis may be used for genetic and chromosome testing in the second trimester. These include a family history or previous child born with a genetic disease or metabolic disorder, such as cystic fibrosis or Tay-Sachs disease, chromosome problems, particularly Down syndrome, fetal sex if sex-specific problems such as hemophilia must be identified, fetal infections, central nervous system diseases, skeletal diseases, and blood diseases, chemical problems or enzyme deficiencies, risk of neural tube defects such as spina bifida, a mom-to-be is over 35 by the pregnancy due date, and when maternal screening tests are abnormal. Amniocentesis may also be used in the third trimester to check for fetal lung maturity, uterine infection, and Rh disease. The test is often performed between 16 and 20 weeks of pregnancy. By this point, your uterus is large enough and there is enough fluid surrounding the baby to make the test possible. How is the test done? Ultrasound is used to locate a pocket of fluid where the baby and placenta are out of the way. Skin is numbed, and a needle is passed through the abdominal wall into the uterus. About an ounce of fluid is withdrawn with a syringe. If a woman is carrying twins, fluid may be taken from each sac. The use of ultrasound to guide the needle helps avoid problems, but doesn't eliminate all risk. Some complications of the test can include cramping, bleeding, infection, or leaking amniotic fluid from the puncture site or vagina. Risks from amniocentesis include injury to the baby, placenta, or umbilical cord, miscarriage, or premature labor. The risk of miscarriage is less than 1% after amniocentesis in the second trimester. This is only slightly higher than the normal risk of miscarriage during the same time. Certain factors or conditions may interfere with amniocentesis. These include a pregnancy earlier than 14 weeks, the position of the baby and/or placenta, the amount of fluid or the mother's anatomy, and pregnancy with twins or other multiples. Fluid samples are needed from each baby. You may have other risks depending on your condition. Be sure to discuss any concerns with your doctor before the test. Bleeding from the baby to the mother can occur, which can be a problem. An Rh-negative woman should receive RhoGAM after the test to prevent isoimmunization. The good news is that over 95% of women who have amniocentesis learn their baby does not have the disorder the test was done for. If you would like further information, check out our book, Your Pregnancy Week by Week. You may also want to check out our book for partners, Your Pregnancy for the Father-to-Be. If you want to find out more about our podcast, visit our website, yourpregnancyweekbyweek.com. Looking for something specific? Check out the podcast topics list. It lists topics covered in each weekly pregnancy episode and our Let's Explore More segments. Follow us on social media for updates, new podcast episodes, and important information. Visit Your Pregnancy Week by Week, all one word, on Facebook and Instagram.